Thank you all so much for coming. This is the NATA SLC Fall Webinar. My name is Kate Grady. I am the District 5 representative for the SLC. So shout out to District 5 people. Thanks for coming. For this event, we do ask that you keep your mics muted and your cameras off. We'll be able to use the chat function. And then we're gonna have a Q&A session after the presentation. So once again, you can throw all of your questions in the chat. And I will pass them on to Dr. Carr. Once again, take this opportunity to follow us on social media. We've got Instagram, Facebook, and Twitter. Stay up to date on all of our events. We've got a lot of fantastic opportunities coming up in the near future and over the rest of the school year. So definitely stay tuned. Lots of opportunities for networking and for learning new skills. Definitely keep an eye on that. We also want to announce that the 2022-2023 SLC applications are now open. So if you're interested in getting involved with the Student Leadership Committee, you can scan the QR code at the bottom of the PowerPoint slide, or you can check out our social media. It's going to be in the bio of each of those platforms. It's really an excellent opportunity to serve on the SLC. It's great to build leadership experience. It's great to build networking. It's a really great way to find mentors as well. So people that have been in the profession and can kind of give you pointers on how to get a job. And then like even throughout your clinical work, just give you pointers, help you out. It's a fantastic opportunity. I definitely recommend jump outside of your comfort zone and apply for the SLC. You won't regret it. All right, so it looks like we've got a good group of people on, and I'm sure we'll have some more people sign in as we go. So once again, thank you all for coming. This is the 2021 NATA SLC Fall Webinar. We are super excited to have Dr. David Carr from Missouri State University. Reminder, keep your cameras off and your mics muted throughout the presentation. Any questions that you have, you can throw in the chat. And there's going to be a Q&A session afterwards, so feel free to type all your questions in the chat for that. And with all that said, I'm very excited to introduce Dr. David Carr. Thank you so much for being here tonight, and I will hand it over to you.
It's my pleasure, and thank you for the invitation to share this work with your members. Give me a second to arrange technology here. Get this going. I was planning to do this without my glasses, but I can't see this small screen at home here. So you get the glare. You'll just have to learn to live with it. So my name is David Carr. I'm an assistant professor at Missouri State University. I'm here to share with you a few studies that I've been involved with. Quick disclaimer, I have no financial conflicts of interest to report with this. Not making any money off of this kind of work. And I need to be full disclosure here. The data I'm presenting today was collected in collaboration with several other people. Lee Weiss, Jordan Utley, Stephanie Singh, and Jennifer Volberding. Part of the data that I'm presenting is also work that was done with the NATA's Post-Professional Education Committee. So I want to make sure that they get credit for what we're going to see here tonight. Real quickly, the objectives. I'm going to tell you a little bit about my path and then we'll talk about what are employers saying about new graduates and what can students do to get ready for the workforce. So I'm a visual learner, so I put together a map for this to show you my path. I was born in Orlando, Florida. I was raised in Los Angeles. I went to San Diego State for my undergrad, where I did an internship program, became an athletic trainer, and then went to the University of Michigan for a master's, where I worked at Concordia College. I spent a summer on my brother's couch in Indianapolis, Indiana, while looking for a job. And that job came at St. Louis University here in Missouri. While there, I discovered the University of Southern Mississippi during a baseball tournament, and I ended up going there to work on my doctorate. while at Southern Miss, I met an alumni named Greg Gardner, who offered me a job at the University of Tulsa, and that was my first academic role. From there, I went to the University of Kansas. I was the program director there for 8 years before coming full circle back here to the state of Missouri. Those little red dots represent states that I've traveled to with athletic training. See, I got to get up into the Northeast over here a little bit, Alaska. But you'll also see over here on the right, several countries that I've been able to go to. So if you allow this profession to do so, it will give you opportunities. So just, I would normally say a show of hands, but that's not really going to work for this, is it? How many of you have ever heard these expressions? Kids these days can't, whatever it may be, insert your verb or action, or my generation worked harder than yours, or new graduates can't get this job done. Is that something you've heard? Yeah, there's a hand. Any other hands you want to put up? Those are common generational kind of comments that you're going to see. But is it true? I don't think it is. So if you'd use the chat function, type in what you think employers want in a new employee, just like a one-word quality, ability, skill, something like that. Let's see what you guys produce. Work ethic, punctuality, confidence, initiative, productivity, integrity, passion. These are good. Yeah. I guess some of you may have already read the article that this was from, because you're putting up a lot of what some people call soft skills. I have a colleague calls them human skills. Nobody's put in ankle evaluation skills. I'm wondering why. It's because that's not what they're looking for. Okay, servant leadership. Okay. So we set out to look at exactly what do employers think and what do they want. And now my screen isn't. There we go. So I'm going to share with you 2 research projects that have been done on this project. One was back in 2010, where we did focus group interviews of employers and new graduates. We were asking them, are new graduates prepared for the workforce? And if not, what abilities are lacking? And then more recently, this was through the Post-Professional Education Committee. We conducted a survey of employers that had listed job openings at the Career Center. And we asked them to rate 2 different things, their need and availability. And think of that as kind of like supply and demand. And we related it to the specialty certifications that are coming online for the profession. We also related those ratings to the National Academy of Medicine core competencies and some soft skills that were identified in this focus group interview in 2010. So the focus group, these were the participants. We had 11 employers. We got 5 employees. We didn't get a great distribution on gender there in the 2 groups, did we? These were the people that said they were available to come to a meeting. This was conducted during the national meeting in Pennsylvania many years ago. So there were some real limitations on who could actually get there beyond people that were interested. The work settings were primarily college for the employers and a good spread for the employees between college and secondary. So the focus group, here are results. We asked the employer what's lacking. And one of the comments that really jumped out at us was, it's not the hard skills like evaluation and treatment, it's the soft skills. And through that conversation, we were able to pull these following themes. And the most common was interpersonal communication, the ability to carry on a conversation. Next was decision-making independence, followed by initiative, confidence, and humility, or the ability to learn from mistakes. These were the qualities that the employers were really looking for. If we dig a little deeper, we compare employers to employees. They both agreed, both groups, that interpersonal communication was really important. Interestingly enough, confidence was rated really important by the employees, the new graduates. And I saw confidence pop up in the chat here a moment ago. Employers didn't agree with that. They didn't think that was as important. And also something that jumped out at us, a lot of the employees, new graduates, talked about administrative skills, whereas the employers could care less about your administrative skills. They're going to teach you on the job how to do these things. They want people that come in with interpersonal communication, decision-making, initiative, that kind of thing. So the take-home message, they want your communication skills. They don't want you to take a small issue and turn it into a big issue because of poor communication. They're not concerned about your confidence. They expect it to be low, and they know that it takes time to develop. And they don't really care about administrative skills. They're going to teach you what you need to know there. You need to understand the terminology of budgets and things like that. But when it comes to each institution, they do things differently at each place. Then our online survey that was done more recently, we had 174 participants. The average certified years was about 20. Again, it was heavily slanted towards the college crowd. I think the college crowd has a lot to say and a lot of opinions, and that is the core of our profession from where we really started. So they participate a lot in these kinds of things when we ask them their opinions. And we asked them, is there a gap between what you want and what you can hire? 72% of them said yes. We asked them, are you familiar with the following career pathways? And they were rating these on a scale of 1 to 5. They were very familiar with the post-professional masters and academic doctorates like a PhD or an EDD. They were less familiar with the clinical doctorates like a DAT, and less familiar with specialty certifications and residency programs. Those 2 or 3 right down there at the bottom, these are really new. The clinical doctorate's been around for a while, but it's gaining in popularity and more students are going that route. Specialty certifications, these are brand new. Residency programs, there's not that many of them out there right now that are accredited. So for employers to say they're not familiar with it, that's to be expected. When we looked at this need versus availability for the specialty certifications that are becoming available through the BOC, in every case, the need was greater than the availability. So supply was greater than demand, except for pediatrics. That one jumped out. It's not real statistically significant, but it is different in that there is more supply than need, and that was the lowest on the need. So there's not a whole lot of demand for pediatrics specialty certification at this time. We also asked them to look at the core competencies of the National Academy of Medicine. Again, we're looking at need and availability. Right up at the top, the highest one was cooperate, collaborate, communicate, and integrate care in teams to ensure that care is continuous and reliable. Sounds like interpersonal communication, doesn't it? And then if we look at availability down at the bottom there, the lowest one, integrated practices into policy construction and implementation, documentation, and basic business practices. That sounds a lot like administrative tasks, doesn't it? Then we asked them to look at the soft skills that were identified in that previous study. And they were once again rating need and availability. Right at the top, 4.92 was interpersonal communication. And then for the availability, the lowest was that humility or ability to learn from mistakes. So some take-home messages. Employers are really familiar with our traditional pathways. Clinical doctorates, residencies, and specialty certifications, they're unknown at this time, and that will change as the market adapts. Specialty certification in pediatrics at this time is not really needed or valued. So as the BOC and the profession looks at maturing these specialty certifications, that one really could be put on the back burner compared to some of the others. Employers want someone that can integrate into a team. Even though you may be assigned to work with a specific group, specific team, whatever that may be, they want you to be able to collaborate with your colleagues. Again, employers want someone that communicates effectively. and they value humility in new graduates. Nobody expects you to know everything, and they're hoping that you will ask for help, you will ask for guidance. So now that I've flown through that, I don't even have my clock up here. Type into chat, what do you think employers are looking for in a new employee? Let's see if we learned anything here. Go ahead, you can type into chat. There we go. Yeah, humility, communication, open-minded, certainly. Communication. I got to tell you, while you're out at your clinical sites, take every advantage and opportunity you can to work on those communication skills. Talking to patients, coaches, administrators, parents, any of that experience you can get now will help you down the road. All right. So, what questions do you have for me? I know they probably planned on me going longer than 15 minutes, but hey, I'm efficient. Anybody there? There she is.
Hey, no worries. That leaves us plenty of time for questions. So y'all, if you want to go ahead and type any questions that you have in the chat, we'll get those going. I'll give y'all a minute to type. I know it takes longer.
That, or maybe they have no questions. It was just so clear and obvious.
It's obvious. You did too well.
Yeah, I'm sorry. Yeah. So you can imagine, as a student in my class, I tend to fly right through information.
Hey, we students appreciate that.
As a new graduate, what would you say boosted your confidence the most? The connections, the skill building, other. Obviously, experience and time is certainly going to help build your confidence. Successes are going to help build your confidence. But something that you really need to embrace is learning from your failures. You will learn a lot more from that failure if you take the time to really sit back and critically appraise what you did and what you could do better next time. That will help you, because then you won't make the same mistake, and that will boost your confidence. Where should these be taught, classroom or clinicals? I'd say both. You certainly need to be introduced to the concepts, and I share this research with my students so they know what employers are looking for. But then really, you've got to get out there in the clinical setting and practice these things. We can only do so many mock scenarios with fake patients and whatnot to get those kinds of skills across. Things are scrolling off here. There we go. What is the best piece of advice you have for ATs fresh out of college looking for a job? Is that in terms of interviewing, or is that, I'm not sure what context that's in. I'll put it in the context of interviewing. And I would say, do your homework. Make sure that you have looked into that institution you're applying to, the people that are there. Find out as many details as you can about that program so that you can ask really insightful questions as opposed to asking dumb questions. I'll share an example. What other schools are in your conference? That's something you could easily find out and not ask them. I asked that question at an interview, and just for the record, I didn't get that job. So do your homework and make sure you know as much about that program as you can. Is there anything we can do specifically to help us stand out from other applicants for graduate assistant positions on things such as resumes, cover letters, and in interviews? I think applying and getting on the Student Leadership Council would make you stand out. Getting involved in the profession, whether it's at the national level, the district, or at the state, that's something you can add to your resume. And that gives you something to talk about in an interview other than I taped ankles, I slung water, I cleaned, I did patient rehabs. Everybody did that. You want something unique, get involved. Let's keep scrolling here. Being an international student, foreign worker, besides the basic soft skills, is there anything that would help boost the chances of getting hired over a local applicant? Wow, that's a good question. I've got several international students in my program. You know, networking, I think, is going to be one of the biggest helps, if that's a word, to boost your chances of getting a job. Going to meetings and forcing yourself out of your comfort zone and out of your shell to meet new people. If you're having trouble doing so, find a friend to go with you for a little courage. Work with your program faculty and your preceptors at those meetings. Ask them, introduce me to people. I think that's probably going to help you in the long run. How can you highlight these skills in written applications? Oh boy. I don't know how to express humility in a cover letter. I'm not sure you can do it in written. I haven't thought about doing that. I think more in terms of how you can express these things through an interview when you have an actual verbal interaction. I don't have an answer for that. Kate, you got an answer for that? Anthony?
I think a pretty common question on a lot of applications, at least that I've filled out, has been something along the lines of, tell us about a time that you've faced adversity and how you overcame that. And I think that you can really carefully like choose your story, and you can also choose how you kind of tell that story and make that in a way to show like humility, or to show like, yeah, I realized that I messed up and this is what I did to recover from that. This is what I did to like fix that problem and to grow from it.
Absolutely. Yeah, that would be a good way. Let's see. How might one, as a hiring employer, perceive an individual lacking in interpersonal communication? Boy, I can think back to I can think of several students that I've had that lack in interpersonal communication. That's a real challenge to overcome. I think most of the time when I've found that in students, it's they haven't been given a lot of opportunities to interact and communicate. They haven't been, in some cases, they haven't been forced to. Again, kind of getting out of that comfort zone. So my suggestion would be that's a skill that can be developed. Don't think that it's just something that's intrinsic. And if you feel that you're lacking in that area, then engage people in conversation, quite literally, so that you can get more comfortable with that process. How and when did you learn to apply these skills in your personal and professional career? You know, I didn't really highlight these different abilities until I went about these projects. I didn't think about them directly. If you ask my kids, I don't communicate well. So in the personal life, so they're wrong. I communicate very well. They don't listen is what the problem is. But now that I'm 30 years into this gig, as far as a professional career, that's why I wear glasses, because I can't see. I think it's just things that maybe I took for granted. I wouldn't say I'm the best at interpersonal communication. My sarcasm gets in the way more often than not. And I say things that turn people off before they even know me. And I've probably done that tonight without even realizing it. So I think you need to learn to watch what you say sometimes if you're the smart ass like me. You mentioned that you worked at the University of Kansas. Are you aware if they offer GA positions for athletic training? I did work there. Yes, they do. SLC is definitely the way to go. Yeah. You know, SLC is a great option, but there are lots of other options that you need to tap into at the state and the district level. There's going to be different committees and whatnot that are always looking for extra help. One of the easiest places you can get involved is contact your state president and ask them how you can help out with the annual meeting. They always need bodies to help with registration or details or this or that. And it may not be real glamorous, but it's another thing you can put on your resume of something that you did while you were a student. What can make you really stand out in an interview process when applying to a secondary school setting, a collegiate setting? I'm going to keep scrolling. Is there more? No, just those two. I would say the thing that makes people stand out in both of those settings would be, and I'm rehashing what I said before, doing your homework. There is nothing more impressive than having a candidate that has a really insightful question for everybody in the room. They'll typically give you an opportunity to, do you have any questions for us? Make sure you take advantage of that, because they're not just interviewing you, you're interviewing them. You want to make sure that's somewhere that you're going to be comfortable, somewhere that you're going to fit in and have a chance of growth. So make sure you're asking them questions that are insightful, like describing the culture of the institution or the program. If you have a connection, work that connection. If you don't, say, hey, Susie, I noticed you worked at such and such institution. How would you describe the culture of that program versus the culture of this program? Make them think, make them talk. It's more time for you to breathe during the interview. And it's something that's it's going to show that you're really paying attention and you're serious about their institution. Boy, questions are going to go longer than my presentation, aren't they? In your opinion, what are some key elements we should look for in an employer? This could be through university, hospital, clinic, any other employer regarding benefits, opportunities for promotions, continuing education. Things I would look for in an employer, one of my mentors taught me to ask them, when you have the opportunity to ask a question, you may want to write this down, give them a scenario. It's the end of the first year. We're at our awards ceremony, and you're about to award me the new hire of the year. What did I do to earn that award? And that's going to ask that employer to go beyond those bullet points that are on the job requirements and tell you what they're really looking for in that role. And if they just tell you those bullet points on the job application, then they don't really know what they're looking for, and you should run for the hills. That's not somewhere you want to be. Whereas if they can do and answer a good question, then that's maybe somewhere you want. And if they're really good, they're going to turn that question around on you and ask you the same thing. So be prepared to answer your own question. Do you think it's possible to tell too many personal stories in an interview and get across the soft skills you have? Well, yeah, I've been on interviews where people do share too much information. I would say as long as you're focusing on some of those primary ones that we just highlighted, and you have really succinct stories that you can share, then go right ahead. You don't try to hit that whole list. Go from the top down, and make sure that you practice those stories. Practice your answers to questions, the strengths and weaknesses question. You should practice it enough. Talk into the mirror, talk to a friend, so that you can do it really smooth. So if you want to get stories that talk about those various soft skills, really develop that pitch, if you will, and take time to practice it in advance so it comes across more genuine. Let's see, introduce yourself to the state president, district director, they're happy to meet students. Absolutely. You talk to anybody in a leadership role and introduce yourself, they're going to go out of their way to engage you. So if you're standing at a meeting and you're feeling lonely, look for somebody with one of the little name badges and go talk to them. And where can I find a mentor? How often should I be communicating with my mentor? I've been involved in a bunch of mentor programs at the district and national level where they try to assign people based upon mutual interests. And I have struck out completely with that process. For me, and this is just my own personal opinion, it's got to be organic and it's got to come from you identifying somebody that has similar interests, similar aspirations, similar goals kind of thing. My first mentor was the head athletic trainer at San Diego State. He was my role model. That's what I wanted to do. I'm not doing that now. I'm in an academic role, but he gave me that first step. Along the way, as I think of different mentors that I have, they've been real pivotal, but they've always been somebody that there was kind of a shared sense of values, perhaps. And I think that's just something that comes from talking to the people that you're working with at your institution and finding somebody that you like. There's got to be kind of a mutual admiration there. And as far as how often you should communicate, don't forget the people at your professional education institution or your undergrad. Don't forget those people that you interacted with. Update them on at least an annual basis of what you're doing. Talk to them at meetings. Make sure they know what's going on in your life and in your career, because I guarantee you, and as I said, that head athletic trainer from San Diego State, he's still on my reference list because I keep in touch with him. And in fact, our relationship has grown and blossomed into even better things than it was as just a student to a staff member. There's another one. How can recently certified athletic trainers express their worth in an interview without having job-related experience? Ooh, Anthony, that's a stumper right there. Maybe if you keep it in really general terms, and I'm mad at the profession the way it's developed, in that you see job positions listed for football and they want somebody with football experience. I think that's so stupid, in that an ankle sprain is an ankle sprain. And if you spent even half of a semester with a college football team, you know what the grind is like working with college football. So just because you've been with volleyball doesn't mean that you can't do that job. So I would really speak in general terms about the healthcare that you strive to provide for your patients. Talk more about your skill set with regards to evaluation and rehabilitation, those general skills that can apply to any setting or any job, regardless of whether you have experience there. Kate, how can we use these soft skills to advocate for athletic training and improve interprofessional relationships with other healthcare fields? Did somebody feed that to you, Kate? Where's this coming from?
Yes, I did steal this from somebody else.
Okay. Boy, you guys are stumping me here. I thought these were supposed to be easy. How can we use these soft skills to advocate and improve interprofessional relationships? Well, hey, interpersonal communication is crucial for interprofessional relationships. But I think humility, even though it was kind of low on the list, it was still rated high in general overall. That goes a long way to establishing relationships, to be able to admit to a peer or colleague that, hey, this is outside of my skill set and I need your help. I've been getting into concussion research and stuff, and some fascinating stuff, and I don't know jack about it. And when I get a concussion, I call my colleague that is PT that specializes in it, and I always consult. So that interprofessional relationship is built upon my humility of not knowing what to do and being able to reach out to somebody that does. How would you go about negotiating salary, et cetera? How can I set boundaries, work-life balance when already in a position? Ooh, negotiating salary. I'm not the person to ask about that. My first job was 19,000 with no benefits. Yeah, yeah. That was back in the 1900s. And I'm not going to throw the institution under the bus, but if you go back to that map, you'll figure out where my first job was. Yeah, I think what you need to do is look at whatever available data you can find for salary information. The NATA produces quite a bit of this every year. Use those data points to help negotiate your salary. As far as boundaries, work-life balance when already in a position, that's a tough one. I think you've got to set clear expectations and make sure your employer is going to support you. You know, back in my clinical days, we didn't have cell phones. So people weren't texting or calling at all hours of the day. And of course, they had my home number, but the communication was really different. So I think maybe you set your own boundary of not responding to phone calls or texts after hours. That could be one place that you just start to draw that line, or on weekends or holidays or wherever it may be. But again, make sure that your employer is going to be supportive of this. And if you're at an institution that is not, and you don't feel that you have that work-life balance that you want, life is too short. Get out. Find somewhere else that will support what you're looking for. That's the bottom of the list. Hannah threw another one in there. She's got a lot of questions. Do you recommend trying various settings or stay in one setting? I hope you're getting a variety of settings through your professional degree to give you a taste of what they're like. So as a student, get a variety. You need to look into your crystal ball and say, where do I want to be in 10, 15 years? What do I want to be doing? And then plot out the steps to get there. And I'll tell you, coming out of my professional degree, I did not plan on being a faculty member. That was the furthest thing from my mind. But it was an opportunity that came up. So even when you set that goal, 10, 15 years of what you want to be doing, be open to opportunities that come along. I had no plans to work on a doctorate, but here I am, and I can't see myself doing anything else. So I kind of fell into it. Something will come up in your future that gives you an opportunity to go a different direction. Be bold enough to take that opportunity and see where it leads. So variety is good. Kate, you got any more stumpers for me?
Let me take a look.
Is over communicating something to worry about? Example, I plan on doing XYZ today. What are your plans? What else needs to be done? I'm not sure the context of your example there, but I'm not sure that's over communicating. That's looks like you're making it clear what you're going to do. Can you give me a little more context, Ross? I scared Ross away. I have a tendency to do that. Any insight, Kate, Anthony? Bail me out here. Oh, okay. Great.
Yeah, I mean, I think as long as it's like appropriate to like your role as an athletic trainer, I don't think that over communicating can be a thing. If it's appropriate to your role as a leader or an employer, whatever situation you're in, I don't think that over communicating is a thing. Obviously, there's such a thing as too much information, and that's when you get into more like personal stuff. But as a leader, an employer, or an employee, as an athletic trainer, especially when you're dealing with other people's health, I think that over communicating, making sure that everyone truly understands what is happening, is definitely a good thing.
Yeah, absolutely. Where does social media and soft skills intersect when trying to get a job or when you have a job? Communication, humility, ability to learn from mistakes. I don't know what you're posting on social media. I'd be really careful about what you post. I know employers do take a quick look and see what they can find. And if you're making things publicly available that are questionable, you may not get the call. They may not want you working there just out of fear of what you might be saying or doing. So I know we're in an age of sharing, and if you don't share it or have a pick, it didn't happen kind of thing. But some things really don't need to be shared, and they can impact you professionally. I mean, you've seen it happen to people in all sorts of different job sectors. All right,
I've got another one for you. So as more athletic trainers are entering non-traditional or emerging settings, thinking like tactical, performing arts, industrial, what are some best practices, soft skills, or just ways to stand out and boost our resume moving into these settings where athletic trainers aren't typically recognized?
I think those soft skills transcend any setting. It doesn't matter. I know our population in those studies were primarily collegiate, but I think those soft skills are going to translate any setting. They're going to translate any profession. I've given presentations on this at some of those international countries there where I'm seeing all sorts of other medical professions. They all hear the same things from their employers as well. Did that answer your question, Kate? Yeah, okay. How can I advocate for the medical model at my institution? Oh, I love you, Hannah, and I don't even know yet. I'm a big advocate for the medical model, assuming we're talking about the same thing, where athletic trainers are not working in the athletic department, they're working for a healthcare entity of some sort. Huge advocate for that. One of my good friends is the director of sports medicine, Mark Larson at Boston University. They've got a great model going there. I have him talk to my students every year just to open their eyes to the other possibilities. I know he's been talking until the cows come home about it at professional meetings, in articles and whatnot. As for you, Hannah, I would suggest collecting as much information as you can, as much data as you can on what those models look like. Talk to people that are working in those models about how it went. The transition is the hardest part, is my understanding. And the biggest resistance is not the institution, the resources or structure. The biggest resistance is the people. Whenever Mark talks to my class, I'm always sitting there thinking about the institutions I've worked at and what would prevent it from happening. And it always boils down to one or two key people that would be the resistant stick in the mud and not want to change their practice patterns. But once you learn about that model, boy, there's no going back. It's got to happen. I think it's one of the few big things that our profession needs. All right, how we doing?
Okay, do we have any more questions? Anybody want to throw something in real quick? Give you a second to type.
I think they're all
looks
questioned
like
out.
all questions were answered.
Yeah.
You just did that great of a presentation. All right, well, Dr. Carr, thank you so much for being here tonight. Thank you so much for spending the majority of that time on the spot answering questions. We really appreciate it.
My pleasure.
great to have a platform where students can come and ask those questions openly. We love that. We love to provide those opportunities.
Okay.
All right, everyone. Thank you
My
so
pleasure.
much for coming.
All right. Have a good evening. Thank you.
Thank you.